So I appreciate everyone choosing to spend your Tuesday at the end of November here with me and Dr. Amanda Kelly, or BehaviorBabe. You can know her. I was just gonna say like the horse of a million colors, but then I realized I don't totally know what that means. So maybe that wasn't the best thing, but a person known by many names, and a rose by any name would smell so sweet. So I'm very excited to have Amanda here. She has a doctorate in ABA. She's a BCBAD. She's currently in Florida with breakthrough behavior. And I met Amanda when I was living in California at a conference, and we had run out of water for tea. We, like the conference, had run out of water for tea. And folks were like losing their mind, and not in a kind or helpful way. Everyone was kind of standing around just really complaining about there's no water and this is bullshit and whatever. And Amanda and I just went and got water. And it was just a really nice interaction with somebody at that time. We've stayed connected since. I see Puka is joining us, which is totally allowed and encouraged. She's getting so big. Hi, big girl. Oh my gosh. Amanda is really passionate about supporting our field as a whole through advocacy with parents, but also about supporting our technicians. And that's a value that she and I share. And so she's going to share some lessons learned today. And I hope that that it's helpful. But more than that, I hope that what you hear is that the things that you're experiencing or have experienced, many of us have experienced, and this job is hard, not because you're doing it wrong. It's hard because we're humaning with other humans. And when you do that in like a robust, compassionate, fully present way, it's going to be hard sometimes. And again, that is not an indicator you're doing it wrong. And remember our talk earlier in the month about health and wellness. So if you're feeling that way most of the time, for more of the day than not, we want to evaluate that. But every time it's hard doesn't mean something's wrong. Thank you, Amanda. I'm so glad you're here.
Thank you. Thanks for having me, and everybody who's on the call. Thank you for joining. It is, 5 o'clock if you're on the West Coast. It's 8 o'clock if you're on the East Coast, and I'll leave it to you to do any other time zone conversions. Other than that, if you're in Hawaii, which is where I just moved from in the last year, it's currently 5 hours behind. But when we jump ahead, it'll be 6 hours. So that always messed up me and everybody. And somehow we still all made it here. So thank you again for having me and for putting on this opportunity. Becca and I were talking about, actually, it was almost a simultaneous thing. I had reached out and she was 2 steps ahead, but said, hey, there's this great event, or I hope it's a great event and I want to put it together. And, what do you think? And I thought, I was just that was just really kind of right at the forefront of my mind. One reason is because of where I work. So as Becca mentioned, I'm currently working at Breakthrough Behavior, and I'm now in a very senior role. I'm a chief clinical officer. And in that role, what I do is support and oversee our clinical guidance, our clinical standards, and also I go to our clinics to see, does it actually matter what somebody at a desk or virtually sort of conjures up? Is it trickling down? And my favorite part of my job has been my favorite part of being in this field my entire career is spending time with the clients and or consumers or students or children, whichever language you prefer. And I also just really enjoy seeing people learn and grow. And so that's very evident in the technicians, the analysts, and hopefully in your leaders as well. It should be an ongoing process. So as was mentioned, today I'm going to talk to you about some of my experiences. I love alliteration, hence the name BehaviorBabe. So I named it Lessons Learned, but this is not intended for me to lecture at you. It's intended to be a conversation. And so you have the chat box if that's your most comfortable way of participating, or you can unmute yourself. You can raise your hand, you can jump in. I'm usually quite flexible, as we must be when we're having conversations, and give everybody the opportunity to be a conversation partner. I do have a PowerPoint presented. Most of my PowerPoints are generally images that spark what I want to say. There's a little bit of that mixed in with a little bit more words in case having that in front of you is going to be useful for guiding the conversation. And I'm comfortable sending these to you, Becca, if anybody wants to have them or refer back to them. That is
That would be
totally,
great. Thank you.
yeah, that's totally, it's a preference of mine actually as an attendee. Generally, it's like to be able to have some permanent product or some way to refer back to. So let me go ahead and take an opportunity to share my screen with everybody. And then I'm going to take another moment to get back all of the boxes in the chat here. So I called it Lessons Learned Along the Way, Behavior Analysis from the Lens of BehaviorBabe. And I can explain a little bit about what BehaviorBabe is or who BehaviorBabe is on the next slide. This is a good example of where a permanent product will come in handy. I'm not going to read to you all of these amazing parts of my journey, but I think that they're important for you to understand who I am and who is speaking to you. So I had my background in elementary education. I think that has been very essential in helping me understand typical child development. And I do know that that's something sometimes we can struggle with or lose sight of depending on our client population. I have friends who have their own children or who have neighbors or nieces or nephews, and they're like, oh my gosh, did you know a 3-year-old can string together like a million words? And when they really want to take this like mask with them or their toy to karate, like they can tell you in like 15 different ways. And yes, many children can, and not all children do. And that doesn't mean we should be comparing everybody to one another, but it does help to know, are we setting the bar too low? Often, sometimes I see that that is a potential outcome. I worked for several years as a one-on-one therapist. You can call that a registered behavior technician now. The credential did not exist, so I will not call myself something that I didn't officially have. So a behavior technician, I was called a one-on-one inclusion facilitator. I think I negotiated that title. It meant a lot to me, particularly earlier in my career. And what it was I was pursuing my undergraduate degree in elementary education, and there was a flyer like on the side of a wall, and it had this most adorable child in a snowsuit, and his eyes were as blue as his snowsuit, and he was surrounded in snow, and just gosh, you just wanted to like squeeze him and hug him and kiss him and hold him. And I was just really drawn to it. They were quite good at marketing. They picked a really wonderful picture of their child. And the flyer, I leaned in and said, we're looking for people to work with our son. He has autism. We are looking at this thing called ABA. We're just looking for committed individuals, undergrad students, high school students, and so forth. And they were looking for like 6 to 10 hours a week per person. And I thought, well, that's perfect because I don't really want a job. I loved being in my undergraduate degree, but I did want to gain some additional experience. And it was really when I went to the director of my program and I asked her, the professor, I said, can you tell me what is autism and what is ABA? They didn't spell out applied behavior analysis. And the professor was really dismissive, and her answer didn't really sit well with me. And she said something like, behavior analysis is that horrible manipulative thing that BF Skinner came up with, and autism, well, that's like a child with Down syndrome. And I just thought she seemed really ignorant, lacking information. And so how better to get information than to just call the family and meet them myself. So I pulled the little tab off with their phone number. We had cell phones then. But what's really incredible is that a child at the age of 2 had a diagnosis of autism in West Virginia. That's still incredible now. That's nearly impossible in Hawaii now. And we're in 2021. I think even more further than that is, sort of the beginning of dial-up internet. And they were already receiving a prescription for applied behavior analysis. Technically, this was around the time that the Behavior Analyst Certification Board was being established, but we did not have anybody with those credentials providing any support or oversight. Once I worked with this individual, Johnny, for 3 years, he actually went into kindergarten with 0 support needed and was not, he didn't have any additional needs that couldn't be met in the general classroom and with his siblings at home. And I didn't understand I was like, what do we do? How did we do this? How was this possible? And I decided to shift my career focus. And I wanted to pursue behavior analysis and not elementary education. I, however, did finish my degree. I think that's just, hey, that's up to you. That's your choice. For me, it was a good call to get that elementary to finish up what I was doing. But after that, I looked up positions in behavior analysis. So when I was 21, I moved to Massachusetts and started pursuing interactions and opportunities to work with individuals with autism across different ages and actually with different populations. And what I will tell you right now is that the first job I found was not the job for me. Maybe that's the first lesson learned. No, the first lesson learned is, doubt people who seem skeptical and dismissive, perhaps. But also, it wasn't the right fit. And I really questioned, should I have moved 500 miles away from home? Here I am, I'm by myself. What do I do? And luckily, at the time, there was one other place where I could work, and it was an hour and a half away. So I had to drive an hour and a half to get there. But it ended up meaning to me that I could still stay in the state of Massachusetts. And I know we were talking a little bit about weather. Massachusetts ended up being way too cold for me. And you'll see in that right-hand column, I decided to peace out and move to Hawaii for a bit. So as I mentioned, you can kind of look at this later. You can always like Google information if you want to care more or if you want to lean in more. But I think it's important also for me to share that in addition to being a one-on-one technician, when I did pursue certification, I did so with my bachelor's and got my BCABA. And that's not everybody's journey either. And it has really shifted over the years what that credential means or where in somebody's career it may be more useful. I think in a lot of ways, it's become a more robust credential than at that time. And then I became, BCBA and then eventually a BCBAD because for me, I have an addictive personality and I know that about myself. And so I try to lean in and get addicted to things like education and compassion and talking is one that I have always enjoyed, conversing. And my dad, he still kind of chuckles and comments to me. He says, Amanda, you're pretty in love with behavior analysis and talking. And he's like, but look at you, get invited to speak about what you love. So find your strengths and find the right environment if they're not viewed as strengths and you feel that they are. As Dr. Tag mentioned, when I went to Hawaii, we really focused a lot on advocacy. So I was still working with individuals and with clients. I had my doctorate, but rather than move into like a leadership role, which a lot of people might, or full-time at a university, I realized that my next door neighbors couldn't get access to services. And wherever I live, it matters most to me. Not that I can travel the world and speak, I get a lot of those opportunities, but that I can help my neighbors. And so now my focus is making sure that these services are robust and accessible here in Orlando, in Florida, where I live now. And I feel good about the work and the things that we accomplish in Hawaii. I feel really great. And if you're not aware, autism insurance, the first state to pass meaningful autism insurance reform was Indiana in 2001. And the last state was Wisconsin in 2019. So it took 18 years and it's only been 2 years since all 50 states have provided this coverage. I clicked off my slides. There we go. So as I mentioned, I'm going to talk a little bit today about lessons I've learned, and I hope it doesn't sound too preachy. And if it does, just stop me and jump in and tell a story and share your perspective. Some of the things I did try to do to be really intentional and mindful of those of you who are registered behavior technicians was I went to your task list, to the task list for technicians, and I identified areas where I could tell you a story or provide a recommendation and then directly connect it to the expectations of technicians. The most important thing, I think, and I might have already said that 3 times, the most important thing, it's up to you to decide what value and weight to give it, is to always, always prioritize your clients, the consumer. We are here to protect the consumers and make sure that they have access to appropriate services, that they have high quality services, that if we are feeling compromised, that we're not providing services during those times. It's okay to step away and take a break when needed, when you have personal matters, perhaps. I have those stories too. And those things have happened in my life. And when we look at the task list and the expectations, yes, okay, F5. I feel like sometimes we're playing bingo. It means, it says that we maintain client dignity. And when I think about what does that look like in a session or in the presence of our clients, or even when we are referring to our clients, I think it's really important to consider some of these things that just happen in a day-to-day session. I recently, 2 weeks ago, was at one of our clinics. We have several in the Central Florida area, as well as a couple in other states. And I saw this really incredible interaction. Actually, I'm going to tell you about a lot of incredible interactions and opportunity for refinement. So I went to observe a child that when they had come into our care, they really needed a 2-on-1 staffing ratio. The healthcare funder did not approve that. We decided as a company that that's what was needed for the child to be safe and to make progress. And we made a business decision to provide the second technician without reimbursement. And I went to see this client now, 6 months later, as he's getting ready for his reauthorization, and he's staffed 1-on-1. And I'd love to see that get even more faded back or allow us to get into more group situations. He's definitely not only tolerating, but seeking out other peers, having really positive interactions. He can jump on the trampoline without a staff member being there to intervene on the trampoline. So really huge progress. On the day that I went, his supervisor, the behavior analyst, and the technician were in the room, and the director of the clinic. And then me, I was like, no way does this child need 4 adults to be hovering around him while he's, seated at a table or doing his sessions. So luckily there's a way to view into the room. There's windows and other vantage points. Until I exited, I was like, I don't think this is needed. That's one thing. And I know a lot of times technicians may not feel empowered. We're going to talk about that a bit as well. But it was almost comical with the amount of adults to the student in that room. What I noticed during that time, though, was that there was some sharing, right? One of the conversation pieces was like, hey, I wonder what, Sam is going to want to do after he's done with this activity that he's doing. He's watching videos on YouTube that he really prefers. And the analyst says to the director and the technician, like, I wonder if we should, go get a peer. Yeah, I wonder if we should get, like Carrie or Jennifer. And then they were like, maybe he'll want to do Play-Doh. Maybe he'll want, to do bubbles. And what stood out to me was nobody was asking him a client. And they were, I think, not doing that because he does have very delayed communication. And we're still getting him at the time assessed for speech and language pathology, SLP services, speech services, or services by an SLP. I think certainly they were trying to identify his preferences, give choices. But what they were doing was talking about him in front of him and not with him. The second thing is, you might recall from the setup of the story, he was engaged in a preferred activity. So if he's engaged in a preferred activity, can we either engage in that activity with him, or can we give him the space to just enjoy his favorite song that he's listening to and not talk throughout it? Can we be mindful about where we are? And I tell you this story also because it wasn't the technician. The technician was like spot on, right there, engaging, commenting. And I was really, really proud and impressed of the interaction of the technician in particular. And so something that I did was I modeled some of this when I had the opportunity, when there were fewer adults in the room. But also I spoke to the supervisor and I said, imagine if I was saying these things about you in front of you, but not with you. And again, I think they were very kind and genuine individuals. They meant no harm by what they were doing. And if I hadn't had as many experiences as I had, maybe I wouldn't have picked up on it as the first thing when I went into the room. Really, the news is He's not aggressive anymore. He's no longer engaging in self-injury. He is making communication attempts. We have figured out multiple items that function as reinforcers. And they were so proud to show me that. And I'm like leaning and being like, all right, let's check out our language for a second. It is important, no matter who we are, that we are still givers of good things and providing reinforcement to the people for their behaviors that we want to see increase, whether it's our client, our supervisor, or them to ourselves. And so I modeled it, and I gave an example. I was like, so Becca, I wonder what, Sam wants to do tonight. Like, yeah, maybe we should go to dinner. I don't know. Like, is he going to eat like, spaghetti? And they were laughing at me because they were like, oh my gosh, this sounds so absurd. Like, I completely feel it in this moment. And I'm like, look, it happens. And what I want to tell you is I've had the opportunity to see ABA services in the Philippines and in Canada and Hawaii, West Virginia, and it happens everywhere. So it's not for me to say like, this is what you've done wrong. It's like, hey, how can we take this opportunity? So if you think about some of your own clients, you might struggle to think like, how do we include them if their language is not yet sophisticated or at a level where we know how to converse with that sort of fluent conversation? And what I would suggest is shifting your language to something like, hey, when Sam's done, we're going to go grab a peer. I wonder who's available. Maybe it's this person or this person. Yeah, Sam really loves, I know Sam, I know you really love playing with bubbles and Play-Doh. So when we grab a friend, we'll see which one you guys pick. Now, maybe that's too much language, adjust it and modify it for your client. But there's a way to engage individuals and to talk with them or include them in the conversation, even if they're not at the conversational level that we're comfortable with or that we're used to. There are also times where we were in the session room where we were where he was working in the space, and the supervisor, again in this case it was the supervisor, who was saying like, oh hey, like, so I counted like 10 aggressions. How many aggressions did you count? Or how many, I counted this. How much did you do with this? And as we know, data is critical. And the information that we can get from that can really guide our treatment and allow us to be really cognizant of elevating the individual and providing the appropriate supports. But I do want to just say to everybody that some matters may need to be discussed privately between the supervisor and the technician, and in front of the client may not always be appropriate. So that's something to kind of discern and discriminate for yourself. And then with this piece really about keeping our clients at the core, I have also been the person who's done this. Again, not a lecturer here tonight, but a reflector, if you will, where maybe the parents come, it's the end of the day or it's the end of the session. You see this if you work in schools, different settings, and they're like, how did it go today? And we're like, oh, and we start talking about how many bites of food they ate or how many steps towards whatever they did or how many seconds they engaged with the toy. And I think sometimes people are just looking to hear like, it was a pretty good day. And we sometimes get so trained and conditioned to quantify everything that I don't want us to lose sight of qualifying it as well. So it is important to share the data. It's important also to illustrate the struggles when necessary. I want to make sure for myself in particular and the people who work with me and around me that we're also talking about the really great things that happened that day. Or that session or that hour. Imagine if you have children yourself. I don't, but imagine going, to pick up your child or your niece or your nephew or your neighbor's friend, their child, and someone's like, oh, here's a laundry list of everything they're struggling with. It's like, yeah, I'm actually quite aware. They're in my life. I'm with them and I know that there are these needs. Tell me something that was like a perfect gem about the day. And then, of course, this one I'm going to talk about more because I have a short video, if the sound will work, about being flexible in our teaching. Sometimes I've lost sight of what my goal is, and I just need to like follow through with a task, and I get a little bit rigid on staying so stuck with the task that if I took a step back, I could kind of see the bigger picture and perhaps be more useful and more helpful. So I want to tell you this short story of being at another one of our locations, and this technician had just started and had worked with our company and had only been an RBT for 1 month. I think that's very useful information when you're observing and supporting and modeling. Is like, how long have you been doing this? How well do you know this client? Like, in all fairness, there was just something though so magical about the way she was interacting that I was like, tell me more about what you were doing prior to coming to this, to our clinic. And she's like, oh, I was an early childhood educator for like 10 years. And I'm like, yeah, it shows. Like, it really shows that you know how to play, that you seem to enjoy playing, that you are compassionate. Like, it was such a joy to sit in that session and to be a part of that session. And part of it was going to the sensory room or going and, like, playing it with the slides and going through the obstacle course and taking our shoes off and having squishy mats and all the fun things. And when we went to go, there was an electrician in the room, and the electrician had to rip some wires out of the wall. Apparently there was some snafu, and he was repairing things. So not safe, can't be in there. And the technician started to tell the client, like, hey, we can't, so sorry. It's like, it's closed right now. And he seemed very confused. So I was like, what we can do is we can open the door and show him, like, look, we can't go in right now, right? It's a little bit easier to comprehend when you can see, when you have the concrete examples. So we did. And he was like, oh, okay, kind of. Maybe through his facial expressions, I had that impression. But he was 4 years old. It's very disappointing when you're going to the playroom, the sensory fun place, and it's just not available. Haven't we felt that way when we've gone out to our favorite restaurant and we get there and it's closed and it's not supposed to be closed? It's okay to be disappointed. What happened was this child dropped to the floor and started engaging in what some may classify as tantrum behavior, right? He's upset, he's crying, he's sort of kind of pounding his fist. I mean, just seemingly really out of, not really regulated for his body, right? And the technician starts a timer. And I just look at her. And again, compassionate, caring, early childhood, such great engagement with him, so open to feedback. And I thought to myself, this is what we've taught. This is what we have taught. So I walk over and I say, do you mind if I, speak with him? And she's like, no, not at all. And I said to him, this is really disappointing. I'm sorry you're sad. Can I get you a chair? And I brought him a chair over to him. Interestingly enough, he stood up, kind of walked over to the nearby table and, like, took that chair. He didn't really take the chair I offered him, but he sat at the table and cried. And I said to her, it's okay. There's really no need for the timer right now. Like, it's okay to feel our feelings and to be sad. And she did a phenomenal job, again, taking feedback, being flexible, trying something new, maybe different than what she was taught or instructed. She showed him his visual schedule, was able to provide 2 highly preferred alternative activities. He wasn't having it for about 5 minutes, and that's okay. That's okay. It's okay. And it's also pretty age appropriate to be a 4-year-old who's crying because you are disappointed. Because what you wanted just wasn't available. And it was a very reasonable request. It was on his schedule, like almost like we had promised it to him, because we didn't know the electrician was there. And so we were able to get redirected after a few moments. We played Pop the Pig, if you know that, right? You roll the dice and stuff all the hamburgers in there and then push down on his head. And that was a lot of fun. It gives me a little bit of anxiety. I'm like, oh no, it's gonna pop, but that's okay. That's the game. So I work on that too, And then he was able to go to the trampoline, again, another highly preferred activity. And then she went with him, and that was that. The day was golden. He was great. Afterwards, though, she emailed me, and she said, I really want to thank you, because if I had followed the protocol, it usually lasts about an hour. And I was like, oh my goodness, an hour. I don't want our technicians, I don't want her to have to go through that. I don't want to see the client doing that. But it is difficult to sometimes discern, should I follow this particular procedure? Should I deviate? Should I speak to my supervisor? In that case, I was serving as a supervisor. So there was that direction being provided from me. And really what I told her was, if you're ever in doubt, just be a kind, compassionate human being. Just start there. keep everybody safe, and be kind. So I want to ask you this question, and I hope you'll find, again, whatever modality works for you for participation. My thought to you is to ask questions, to seek knowledge, to ask for clarifying information. I followed up with her supervisor and was like, hey, here's what I did, just so you know, she didn't deviate from your plan on her own. This is what I instructed. So here's my question for you. Imagine that you're on a brand new case, whether you're a new technician or it's a new client been assigned to you, and your analyst provides you the behavior plan and the treatment plan to review. You review it prior to meeting the client and you don't have any questions, or you have your questions answered. You feel really comfortable. You're like, I get it. I understand it. I've done this. I got it. However, once you meet the client, you feel really uncomfortable implementing a correction procedure or some portion of the plan. What do you do? And my question for you is, what do you do in the moment? And then what do you do after the moment? So if you could take a moment yourselves and think about that, sit on that. And then if anybody would like to share, you can either unmute yourself and just chime right in, or you can take a moment and type it in the chat box. One of my thoughts here is, would you do something different in the moment than you would after reflecting? How would you navigate not having your supervisor present to talk to while you're there? How would you navigate that? When I've had this conversation and when I've talked to some people about this, it's been like, well, I just wanted to make sure I was following the plan, and there could be some real concerns about, again, deviating from the plan. That's why I put this question right after that story. Some people have said, well, it's a correction procedure. I feel like maybe it's kind of punishment. I'm not sure that we had any reinforcement first. Okay, that's some really good feedback. You're working with your clients and you are much more, I believe, intimately aware of their preferences, their needs, their desires. As an analyst throughout my career, I have always wanted to be the type of supervisor that solicits, not only asks for it, like welcomes the feedback, but actually asks for it as well, right? They say the best way to get honest feedback is to ask for it. It's to solicit it yourself. Stephanie, thank you for sharing. She shared here in the chat and said, I fall back on basic redirection to a preferred activity. Even if it's the wrong move, we're not going to mess up or upset or make, more intense. She actually said, not going to screw up a kid, which I don't want to change your words, Stephanie. In one instance, by giving them preferred options. Trauma, of course, thinking about that as well. Dr. Greg Hanley talks a lot about trauma assumed versus trauma informed. Like, assume that there's, even by having difficulty communicating, the trauma associated with that. Jaden talks about doing the best you can in the moment, messaging your supervisor as soon as you get the chance. I love to hear that you're immediately contacting them as soon as you can. I know sometimes we kind of have that in our minds, and then like the day goes on and maybe we're with another client and then we get home and then who's making dinner, and then can you watch your favorite TV show? Like, do people still do that? Do we still watch TV? I haven't, it's been so long. And I love to hear that Jaden saying her supervisor is really quick to respond. For anybody who's in the situation where you are providing like any supervision or guidance or support or training, perhaps, it really is so critical what we talk about when we say reinforcement being immediate, right? When we say, responding to people. So it doesn't mean you're going to get a response always that you agree with or that you like, but knowing that you're reliably going to get a response is going to reinforce you reaching out. And of course, that's so very important. And then I also see Erin talking about focusing on the client, minimizing any potential issues, not wanting to do something incorrectly that could harm the client. And then again, discussing with our supervisor, asking questions and asking for modeling and role play activities. That's a really good antecedent suggestion, especially when you're provided like a behavior plan or a correction procedure, because in this case, you didn't know you had questions until you were really in the moment, and maybe role playing would have captured some of that. That's a really, I appreciate that contribution, Erin. And then Paula says, in the moment, try your best with what you know. And again, supporting what has been said, going to the supervisor right away. Stephanie shared here in the box in the chat that she had one instance where follow through of an SD of the instruction didn't seem appropriate and she followed her gut. Turns out that the client, little girl, was scared of men and she wasn't going to force her to stay in the room with a male RBT. Yeah. You know, having to investigate and discuss that with the supervisor. And yes, you do spend most of the time with these kids other than their parents. So it gives us an opportunity to observe and to see things that may not always be spoken or shared with us by our clients and the consumers. That's a very, very valid point to contribute there. And the other piece that I take away from what you had said in that last comment, Stephanie, was, these things don't have to make sense to us. I remember one time we had a client who was engaging in challenging behaviors and it felt so random, right? When people say, I don't know why this is happening, I can get behind that. When people say it happens for no reason, I'm like, maybe not one that we can currently detect. And I'll spare you the length of the whole story, but it was wearing red clothing. It was red clothing. So it wasn't men, it wasn't women, it wasn't shampoo, it wasn't, sometimes it was at Target. Okay, yep, everyone there has a red, red shirt. And it was so very challenging to narrow that down. Now, where did the history of the red shirt come from? I'm not sure. I don't know. And it wasn't just a red shirt. I mean, it was a red baseball caps and things like that. Maybe that's somehow connected to some trauma. Maybe it's just an association or a pairing of some kind, I don't know. I don't know that part. I don't know, but we did know, hey, this individual seems like they're in distress. And if they're in distress, I'm not going to contribute to doing more of what's bringing that on. I think that's really a theme of what I'm hearing in these responses here. And again, I really appreciate all the participation. Kelsey said when she first started in this field, she thought no matter what, she couldn't stray away from the plan. I felt the same way. That's why I'm asking this question. And I'm feeling really excited that your answers are so spot on, because I feel like for me, that took a lot of practice and needing to build confidence on trusting my gut, right? Now, if we were always just haphazardly doing things, that would be a problem. If we were not communicating to our supervisor, that would be a problem. But I think if we are listening and trusting our gut, that is always a really good place to start. Communicating again with your supervisors. Perfect. Thank you so much. That was such a robust response. I have a few more, so let me not talk the whole entire time. Let me keep going. As I mentioned, we're going to connect these to some of the objectives in the task list. So your responsibility is to generate objective session notes and to comply with legal and workplace, all these things that are needed to happen. But number one, it's to keep the clients at the core. Yes, we are all humans first. And you know what? Sometimes there are really, really strong reasons why we definitely should and definitely should not deviate from something. But generally speaking, if you trust your gut and it's a one-off and it wasn't the right thing to do, we're going to be able to move forward. We're not going to have too much history to compete with. It'll be okay. And yes, really helping people understand how to navigate through things and feel like you're making really ethical decisions. So it's not just about, what your supervisor tells you, it's about what this client needs and what the rights of the client are. There's a wonderful article in 1988, Van Houten and colleagues, called The Right to Effective Treatment, and talking about how the right to effective behavioral treatment is first and foremost, it's paramount, and that the client come first and their needs come first. So when we're thinking about data collection though, and we're thinking about how we measure it, it's really important that we're not just saying, oh, we had 2 instances of elopement today, or we had, X amount of, mans per session. It's fine. People can talk how they want to talk. I'm not going to overly police that. For me, when I have somebody say to a parent in particular, like, oh, he manded 50 times. I'm like, what is that? Who talks like that? Like, how about he asked for some of his favorite things and he did it so much? It was like 50 times in an hour. That's something that takes a little bit less translation. And one of the barriers to people getting really excited about what we have to say and what we show them is just like not understanding the language and not feeling comfortable enough to ask, and or not having enough energy to sit there and just try to decipher. It's like, okay, great. I'm gonna take them home now. And I picked this image because I want to know what story does the data say. And if you read that middle section, it says blah, 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 marketing. Yeah, sure. Sales stuff, free lunch. Like, get to the point, use language people can understand, and tell us what it means. Tell us what it means. And, you know, to get back to the last point, like, your supervisor can look on a graph and go, oh, this is going down. This behavior that we want to decrease is going down, but maybe it's going down for completely different reasons than they want it to be, or than they think, or that they're aware of. And by you sharing that information with them, by you trusting your gut, by you really leaning in and communicating with them, it is more than just data points and a visual display. It's the story, right? It's the human, it's the story about the individual and all their amazing successes and adventures and struggles throughout the day. I mentioned to you a little bit ago that I have had difficulty sometimes, like, focusing on, like, what's my goal? What's my goal? What is it I'm supposed to be working on? Again, there's some stuff over there on the left-hand side that talks about how this connects to the task list. And I think that that's very important. I certainly respect the guidelines set forth by our certification board. On the right-hand side, you see an image of shoelaces, and how cool that it just spelled love. I did love that. And I remember I was working at a preschool. I was working as a one-on-one ABA inclusion facilitator. My fancy job title I got negotiated. I think I may have been already a BC ABA, and if not, I was pursuing that. But I was definitely working in the capacity like a one-on-one provider. And I remember, we'll call him Charlie, was supposed to. We were working on social skills, right? And Ashley Rose, I love that she really reframed that for me. Social interaction, social engagement. What are social skills? You know, it's like, sounds like a ingredients, and we're gonna make some recipe instead of like a human. Again, so I really enjoy hearing others describe the same things and phenomena that I know, and so that I can lean in on their language. So I had told Charlie to talk. Hang on, I'm
Dr. Kelly, I think your internet has sort of bugged or sort of like glitched a bit. You're frozen on our end and we're not able to hear you. I also realize I'm saying that and you may not hear me, so I'm going to text you also. Hang tight, everyone. I appreciate your flexibility.
Oh, I'm so sorry about that. Can you hear me now?
Yes, I can hear you just fine now, and no apology necessary. Sometimes I think technology snafus just to remind us that we're not actually in control of much. So I take it as an opportunity to practice flexibility, which the universe continues to send my way, and I've not yet mastered. So you had just started telling the story when it went out on my end. I'm not sure about everybody else. What's the last thing you all heard? If you don't mind kind of chatting in the box, typing in the
Chatting in the
chat box
box.
there. Same spot before the story. Okay.
Yeah, I'm getting a notification that says that the internet is unstable.
Okay. Well,
Kind
we'd
of like
love
myself.
heard loud and clear, Amanda. You are in good company. You're also welcome to I can drop my video. You're welcome to just chat instead of share video, or you could even do the screen share without the video, whatever feels most comfortable for you.
something there in the chat. I was starting the PowerPoint and it seemed to have froze on my end.
Okay, we could see the PowerPoint, but if it seems like it froze, we're happy to just listen without the visual.
Okay, let's do that. And I will get everybody access to this visual. Thank you for that and the flexibility. I love that. I love that language. We were just talking about language.
Yes, yes. We can't try to teach our kids flexibility and then be rigid ourselves. We've got to walk the same walk we're talking. So,
you know, my therapist told me that today. She said, she says, you teach children all these things. Look at you practicing them. I was like, thank you, Carrie. Thank you. So the story I was saying was that it was time for us to all go out on the playground. Time for everybody to go to recess. And what the focus of that time for the individual, for Charlie, was that we were going to play with friends, and we were going to try, you know, entering into an activity and all those fun things. And I said to him, I need you to put your shoes on, and then we're going to go outside. And he didn't put his shoes on, and he struggled to follow that instruction. And I found myself so stuck on needing him to put his shoes on. And I was taught early on that you follow through with the demand once you provide a demand. And so there I was, 15 minutes into what should have been a social opportunity, and we're inside by ourselves without our shoes on our feet. And it wasn't until my supervisor, who wasn't there all the time, and so she came to that preschool, and she says, "What's going on? What are you guys doing?" And I was like, "Well, we're supposed to be outside playing with his friends, but he won't put his shoes on." And she walks over and she says, "Hey, can I help you put your shoes on?" And he's like, "Yeah." And he sits down and she puts his shoes on for him. And I remember in the moment feeling so frustrated. I felt like she had undermined me, that I wasn't able to follow through, that she was going to be, you know, providing reinforcement. And I just had not yet developed the skill of understanding, prioritize your goal. What's your goal right now? And it's okay if I didn't follow through on like what making him put his shoes on. That wasn't a real skill that we were really working on. It was just me feeling like I needed to stick with the instruction. So that's why that image, when you do see the PowerPoint, is a picture of the shoes. And so remember your goal, remember what your goal is, and pivot back to what your priorities should be. Sometimes we're working on more than one thing, or sometimes we do the same activity and it can have multiple goals depending on what we're doing at the time. So I just wanted to share that story to illuminate that it's okay to not always follow through, and it's most important to remember what your target or what your goal is. The next thing I have is a video, and since it's probably not going to play given the technical snafus, I will drop the link for you and you can at your leisure watch this. I do have a website and a YouTube channel and on all the social media spaces, except TikTok. I think I have only had one TikTok video and it was of Puka. But I can share with you a link to this video. And what I will also do is I will drop for you the questions that I have in my PowerPoint. And while you're watching the video, I would love it if you could be mindful and thinking of these questions. So I'll send you the link in just one moment. The questions that I would want for you to consider are, you know, where's the child and location to or in relation to the therapist? Full disclosure, the therapist is me. I don't usually put other people in those vulnerable positions, or one that I'm not willing to put myself in and share online. The video is of somebody who's not a client. I think it's very kind of funny that it was a colleague's child who was typically developing, and yet the video starts with her saying, "I was under the table, did you see me?" And I was like, "Yeah, I saw you. I saw you giving me a run for my money," Paige. So in this video, ask yourself, where is the child located in relation to the therapist? What's the expectation for the child to be at the table? What are the reinforcers used in the session? What errors did you notice in the teaching instruction? And if you had the opportunity to do that session, what would you have done differently, or what would you do differently? So I am struggling to find the ability to open that website, but once I find it, I will make sure that I share it for you in the chat. Becca, are you still able to hear me?
Yes, ma'am, we can hear you great. And we also heard Puka finding her voice.
Oh, she certainly has found her voice.
I love, love, love. I know it's so hard when all you're seeing is the just names without faces or any kind of input, but we can hear you loud and clear.
Okay,
And
good.
I
I'm
see
glad
those
that that's coming
coming
through.
up in the chat. Yep.
Perfect. Okay. So that link, if you want to click on it after or click on it and then pause it, and then you can have access to this video. Those are the questions that I was just referencing that you might want to think about as you're watching this video. It's 3 minutes and 27 seconds long, so shouldn't take too much of your evening. And you can always reserve it for watching when you need maybe a break from Thanksgiving. A couple of other things that I wanted to share in the remaining time that we have, and I really appreciate everybody's flexibility and again attending, is be willing to challenge the status quo. I know we've already mentioned trying to create spaces or developing some skills around being assertive and professional, yet I think, valuing your own voice. I think that your clients need you and your supervisors do too. So I encourage people to say, hey, I have another idea. And you may not have the same schooling or the same, amount of experience in the field. But as was mentioned in the chat earlier, this client as you're spending the majority maybe of time with them, maybe more so than most people in their lives. So again, I really appreciate that contribution. Here's another question I have for participation from all of you, which is, how comfortable are you with providing feedback? And how comfortable are you with advocating for yourself with your supervisor? And while that's a continuum and it might fluctuate depending on who you're speaking with, the question I'd love for you to contribute or share is, how do you prefer to receive feedback from others? What way, when feedback is provided to you, do you find the most meaningful? I'll pause for just 1 minute and give you the opportunity to think about that and to share if you'd like to in the chat. Since so many of you type such long responses, which is wonderful, so in depth, I'll give you a moment certainly. And I also put for you the question in the chat since you can't currently see the PowerPoint slides. How comfortable are you with providing feedback and advocating for yourself? And how do you prefer to receive feedback from others?
And I just want to chime in that if you're joining from Del Mar and feeling less comfortable typing openly, you can do a direct message to Dr. Kelly. I certainly want everyone to feel comfortable participating as much as possible. And I also want to name that my presence as a supervisor may skew some of our own team members' participation. So please do know that you can send it to her, or anybody else who feels less comfortable sharing in the open chat. You can send it to her directly. Sorry, Dr. Kelly, for interrupting.
No, what a wonderful contribution. It is so important that we're always looking at the influence of our presence in the conversations themselves. So I love that. And also, if it's something that you really need to think on, I invite you to do that. Again, as I mentioned earlier, some of the best way to get really honest and appropriate critical feedback is to ask for it, especially for me as a supervisor. I think if I don't ask for it, sometimes people they're not going to share it. They may not think it's important. They may not value their voice yet in the way that I do, and the way that Puka does and has found her own. Thank you for sharing in the chat here. Prefer receiving feedback in the moment. It can be really helpful to have it connected to what we are experiencing rather than kind of trying to recall back. Getting more comfortable advocating for yourself and asking the why. The why. If you're working with somebody who cannot articulate the why, that should be a red flag. That should be a sign or an opportunity for, how you can lean in and try to help people feel more comfortable with that. We should all have rationales for the things we're doing, particularly as we are involving ourselves and hopefully helping individuals with the things that they've selected or that are important to them. Jaden says her supervisors are amazing and extremely supportive and welcoming to ideas. And so personally, she's sharing she prefers verbal feedback in the moment and or while discussing the topic. Yes, some people feel comfortable getting group feedback where it's kind of a thing where we're all meeting as a team and talking about it. Other times we want individual feedback. And this goes for both correction as well as for praise. Not everybody enjoys or prefers receiving public praise and acknowledgement. At the organization where I work, we have what's known as like a bucket list or breakthroughs. And so you can get and give, every individual has the opportunity to give their colleagues recognitions. And I recently learned that those recognitions can be given privately, not always publicly. So that's really insightful and important to remember. And I think we know this about our clients. So we're like, oh yeah, our clients definitely, we individualize so much and we may not always see everybody else around us as opportunities that are similar in so many ways. So I want to give you another scenario, and then I see that I want to be respectful of our time, and I just will leave you with a couple of thoughts after this scenario. Let's assume you've been working with a client for 6 months and a new technician joins your team. You notice that they're not following the protocols as designed by your analyst or the supervisor. What would you do? Who do you speak to? And what kind of support could you provide? Again, I'll type that or drop that in the chat box if it's easier for you to read it, since our slides are currently not cooperating with me here. And then I'll reread it for you if you also prefer to receive information that way. Whoops. So let's assume you've been working with a client for 6 months and a new technician joins the team. You notice that they are not following what is designed by the supervisor. Who do you speak to? When do you speak to them? What kind of support could you provide? I see some of us taking the opportunity to use the private chat, and for some reason it's not allowing me to copy and paste that as well. So I apologize. Yeah, you can go right to that individual if you have that working relationship. You don't have to have necessarily a hierarchy or authority. You can say, can I help you? Or, what I do in that situation is sometimes helpful as a way to frame it. Definitely, you could speak with the supervisor. You could also ask for clarification. Maybe you're not doing it the way that you understood it to be described and you thought that you were. And maybe that fluctuation is something that is a reflection that when we reflect on our own interactions. And so by seeking out that information, that can really tell us like, oh, okay. And who is it helping? The client. And who are we here for? Our clients. The other piece of information I want to give you is to just, again, encourage you and empower you to use your voice and to share with you that I believe learning is bidirectional. So, you may get information, we may get information from the clients themselves and from their parents. We certainly also get information from our supervisors, and we can provide that information to our supervisors as well. It can also be something that is done amongst colleagues and really at every single level of anybody who's interacting with the client or with us just throughout our lives. Really, I think one of the best definitions, albeit a bit technical, that I heard for friendship is a meaningful reciprocal exchange, mutually beneficial reciprocal exchange. Some wordy thing like that, but basically meaning everybody gets something really wonderful and fantastic out of the interaction. Questions for you to kind of ponder and think about is, what does your company do to increase your knowledge? Are you being offered professional development opportunities? Is your supervisor pairing and mentorship or mentor intentional, or is it just who's available? What is being done and how are you feeling supported with regard to professional growth? And are there opportunities for leadership or advancement within the organization or just even within the field? If you haven't thought of those questions, if you haven't thought to ask those questions, or at some point, if you are looking to transition to a new company or if you move, those are some really great questions to be asking when you're having those interviews. And as we were just saying, learning and communication is bidirectional. I think that when individuals are applying for positions and being interviewed, it's also your opportunity to interview the company. I do want to add that there was another direct message to me that said, ask the individual if they're open to feedback. And if so, provide it appropriately and kindly. And if they are not or not available in the moment, go to the supervisor and also let the supervisor know that you did try to have that interaction and felt like maybe this was the next step. So I appreciate that a lot. The last two things that I really wanted to share with you is to just tell you that this is a responsibility that is a big responsibility. As Becca mentioned, I'm so passionate when I see the gains and how meaningful the growth can be for clients, for consumers, for ourselves. By the way, if we understand behavior analysis, we should be able to help ourselves directly in our own lives. But this is more than just a day job. This is an opportunity to shift and change lives and to have our life changed as well. And there are times in my experiences where I've had to ask myself, like, would I be willing to risk my credential, or would I be willing to lose my job? And that's a very, very tough decision that your circumstance is going to definitely dictate. You may not have the flexibility or the freedom to just up and walk away. So what can we do within what we have, available to us? How can we advocate? How can we ask questions? How can we get our needs met within the organization? So for me, it has always been more than my day job. I never knew it was going to become my life's passion. And lastly, I just want to ask you to check in with yourself and to articulate and know what your values are. And I want to empower you to value your values. And I think that that can be done by communicating your needs, but most importantly, honor what your heart and your head are telling you and invite others into the conversation with you. And with that, I want to thank you for having me, for hearing me, for participating in the conversation, and for allowing me to share with you some stories of reflection and growth throughout my career. Thanks, Puka, and for having Puka join us tonight as well. Thank you so much. I appreciate the opportunity, Becca, and everybody.
Thank you so much, Amanda. As always, I really appreciate that you share with enthusiasm and humility. And I think one of the things that we certainly share is that we love behavior analysis, and not just because it exists all around us and it's a way to enrich the lives of others, whether it's our staff, the kids we serve, the parents we serve, the adults we serve, my partner, my friends, myself. It just is such a powerful tool. And I appreciate the effort that you give and have given in sharing that, right, in dissemination, including here with us tonight. I'm going to go ahead and stop the recording.